The prostate gland in males enlarges under the influence of testosterone, and we know that many males, because of this situation, which is called medically benign prostatic hyperplasia, develop urinary symptoms. I want to talk about what is the basic philosophy of treatment and how do we look at whether the treatment is working or not for you. The first thing to understand is how do we rate, score, or in any way say whether your symptoms are severe, mild, or what kind of symptoms do you have. So for this, there's something called a standardized scoring system known as the International Prostatic Symptom Score, or IPSS. This is available on our website or on the internet, and you can Google it and look at the score yourself. It's a series of questions, and the yes or no answer to each question gives you a point score, and the total of the points gives you a score. And what we say is points less than 8, it's very mild or no problem, and 11 upwards is relatively more severe problems. So how do we treat patients who've got significant problems? Usually the initial approach is to give drugs. So I want to talk a little bit about what these drugs are and what they do. So the earliest drugs which got used for this was something called alpha blockers. Now alpha blockers work on muscles in the base of the urinary bladder and the muscles in the wall of the urethra, which is the outlet of the bladder. What they do is they relax these muscles. And when these muscles are relaxed, it's easier for the patient to pass urine, and in most cases, a lot of symptom relief is obtained by doing this when the prostate is enlarged. There is another approach to this which came about with more research, which is to block the primary cause of enlargement of the prostate, which is the hormone testosterone. So actually, the prostate is most affected by something which is made by the body from testosterone, which is called dihydrotestosterone. And drugs which block this conversion reduce the effect of testosterone on the prostate and can actually cause an enlarged prostate to shrink over some period of time. These are called alpha reductase inhibitors, or ARIs, and these drugs need to be taken for a long period of time to have their effect, at least 6 months or more, before they'll cause any significant reduction in the size of the prostate. What we have learned over the years is firstly that the combination of both the drugs works better than just using one drug. Secondly, when the prostate size is significantly large, say 50 grams or more, then these drugs are not very effective, because effectively these drugs will produce a symptom score reduction of around 3 points. So if your symptom score is around 8, 9 or 10, it may be effective in reducing it to a point where there is significant relief of symptoms. But if your symptom score is high, say 20, 25, you cannot expect much relief by taking these drugs. And this is the group of patients where the procedure of prostatic artery embolization can significantly improve their quality of life without the risk of major surgery.